Hello, my name is Oaitse Hellard, and I am a graduate of the Patient and Community Engagement Research Program from the Continuing Education Department of the University of Calgary. Something I liked about the PaCER program was the collaboration between patient participants and professors in developing research that influenced their care in the hospital. Something I loved about the PaCER program is the focus groups and the narrative interviews really gave a voice to patients, and they really felt heard and understood. Taking pride in completing research and having it to be a stepping stone to careers and possible graduate work. The first instructor was an instructor through my BCR DS program. She referred me to the PaCER program in continuing education, and she was one of my favorite professors, Dr. Svetlana, and really enjoyed her mentoring throughout the program. Definitely, number one, the patients and participants feel heard and validated. And then the second piece is knowledge translation. So being able to communicate and present this to doctors, healthcare workers, nurses was an eye-opening experience, and it showed them a different perspective from a patient's voice, and we've seen direct change in the hospital setting. Well, there's three different things I would want to say. The first one about the emotional side is it really gave a voice to the patients. They really felt heard and validated because it was different from the other types of qualitative research, which were surveys. And this was more from their voice and their perspective. Plus, it also showed them that doctors and healthcare workers and the medical side were interested in their voice because it was a collaboration. It is a collaboration with Alberta Health Services and Cummings School of Medicine. So that's number one. Number two, for the participants and the students, this is definitely an avenue to learn how to do research. If you want to do your master's and step up into grad school, this is definitely a way to learn how to do that. So, which is something I'm thinking about doing. The third thing that is really a benefit in taking the PaCER program is you could become a published peer-reviewed author through this program. And that's, again, a stepping stone into doing your master's or graduate work. Because I work with clients and patients full-time as team lead in the organization Options Rehabilitation, it allowed me to hear their voices better, to advocate for them better, because that's what we did as in PaCER, was advocate to help the healthcare system with their treatment and their ability to care for patients in a prompter way, in a better light. Yes. If you want to take PaCER, there's definitely a couple of steps that help you promote you in your career and give voice to yourself and the participants and patients involved. Definitely, number one, the patients and participants feel heard and validated. And then the second piece is knowledge translation. So being able to communicate and present this to doctors, healthcare workers, nurses was an eye-opening experience, and it showed them a different perspective from a patient's voice, and we've seen direct change in the hospital setting. It showed us that we can have change, we can have influence, direct change, just by completing research with participants, and to have that kind of power is rewarding and really helpful.